What makes dental work in Costa Rica stand out? Top dentists.
I did my postgrad in Boston University. I was in Boston for 3 years doing my specialty in prosthetics. And then I worked for the school for a year.
And results.
My name is Flikier. I'm a prosthodontist. I'm a specialist in crown and bridge. And I did my dental studies in Costa Rica. And then I did my postgrad in Boston University. I was in Boston for 3 years doing my specialty in prosthetics. And then I worked for the school for a year. I was teaching and working in a private clinic that Boston University has. And then I came back to Costa Rica in 2004 and established the clinic. The way we work here in the clinic is I have a team of specialists in each field of dentistry. So even though I'm in charge of making the treatment plan and I'm responsible for all treatment that are being performed at the clinic, I like every step of the treatment to be performed by specialists in each field of dentistry. So we have Dr. Ivan Navarro. Dr. Navarro was my teacher when I was a dental student. So he has many years of experience. He has a degree from Miami and his specialty has a lot of experience in surgery, and he has placed many thousands of implants throughout his life. Then we have Dr. Blen. He's an implantologist as well. Became an implantologist in Chile. He was there for 3 years. He came back and joined my team, and he has been practicing already for 10 years. Then we have Dr. Izrael. Dr. Izrael is an endodontist. She's a specialist in root canals. She's graduated as an endodontist from Costa Rica, and she was one of the first promotions of endodontic specialist in Costa Rica. So her training was very thorough, since all the program was being supervised to make sure that it complied with international standards. And she has been an endodontist for more than 13 years. And she does all of our root canals. We have Dr. Grunhaus. Dr. Grunhaus did his specialty in periodontics at the same time that I was doing my specialty in prosthodontics in Boston University. He happens to be my first cousin. He's an excellent periodontist. His training was for 3 years as well in Boston University. I started work. We have Dr. Daniel Weiner. He's an orthodontist. He's a head teacher of the specialty of orthodontics in the La City University here in Costa Rica. He's one of the person that has done more Invisalign cases in Costa Rica, and he has many years of practicing the orthodontics as well. So what we do is to try to provide the patients the best quality treatment that they can get, or the standard of treatment that they will get if they were in the US. How do we achieve that? We achieve that by using the best materials available worldwide, using high quality implants, using high quality zirconias for the crowns. We have our own lab, and that is managed by an Italian technician that is very high end, and that way we can ensure that every step of the way is trying to give the best quality treatment. Another thing that we do is that we see one patient at a time. So our patients are always scheduled. We are very good at measuring times. So the patients almost don't have to wait on a waiting room. And when we are with that patient, we are paying attention specifically to that patient. We're not jumping from one chair to the other and treating many patients at the same time. So we are focused on the treatment that we're providing to that specific patient. When a patient contacts us, the most important is to have the most of information the patient can give us, the more accurate the treatment plan and the estimate is going to be. So if the patient can send us a panoramic x-ray, full mouth x-rays, if they have a CT scan, if they have pictures, if they have gone to a dentist back home and they already have a treatment plan, if they can send us all of that information, we can have a more bigger view of what's going on, and we'll be able to provide a more accurate treatment. The least information we need is to know what type of treatment the patient is looking for, so we at least can give them a price of that treatment. If they don't have the information, once the patient comes into the clinic, what we were gonna do is we're gonna take all the x-rays, we're gonna do a clinical exam, and we're gonna present a treatment plan and an estimate, and we will do this work for the patient. Before doing any work in the patient, we're gonna make sure that the patient understands what they're gonna go through. In our office, you're gonna have or find savings. For example, in all of 4 and all on 6, up to 50% compared to the US. We will provide you with high quality and work. So that means we're gonna use implants that are made in the US. We're gonna use a zirconia that is an Italian zirconia. So you're getting very high quality materials, and that is more expensive, of course, and that's why we need to charge a little bit more than other clinics. When the patient comes into the country, we can help them set their hotel rooms. There are hotels that give the service of picking the patient up from the airport and dropping them back to the airport. And here in the clinic, we're gonna give them, all the support that they need from a medical point of view. We try to do everything under the most secure circumstances to avoid any type of infections, any type of emergencies. But anyway, we have an emergency setup plan in case something were to happen. Thankfully, in 19 years, we haven't had to use it, but it's always good to have it in place. And we are available for the patients 24/7 while the patient is here. I usually give them my personal cell phone number, and they can reach me anytime if there were to be an emergency. I can tell you, I would say 99.9% of the patients don't need to call us because we are very precise in giving instructions of postoperative care. So that's something that should not patients go by the treatment very easy.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.